Hi everyone, how are you doing? I hope that as I'm broadcasting out to you from the CPR Kids office, I'm so excited to be able to come back into the office again. It's great. I'm so happy to be here. I am on Gadigal land here, and I am so excited to actually be able to broadcast to you with all my equipment. As it's been a bit tricky at home, but the funny thing is I've left most of the stuff at home. So I hope that you are hearing me okay. If you are, please give me a thumbs up just to make sure that you are hearing and seeing me well, because we are live and technical stuff happens all the time. If you watched Dr. Deb and I on Wednesday, then, she dropped out of the feed. It was just all over the place, but we got through, which is a good thing. So thank you for joining me today. And I am so excited to be partnering with Mudge and Gal as well. Thank you so much, Mudge and Gal, for having me. And I can't wait to continue these on as well. And remember, if there is a subject that you would like me to talk about, please pop it in the comments below, okay, so that we can bring you what you want to see. So for those of you who haven't joined before, my name is Sarah Hunstead. I'm a paediatric nurse, a mum of two, and founder of CPR Kids. And what we do is it's child health education. We talk to you all about stuff to do with your child's health, mainly around first aid and being confident to do that, and childhood illnesses as well. Today, we are talking about febrile seizures in children. Okay, so let's get into it. Feel free to, in the comments, type any questions that you have while we're on live. Unfortunately, when we're not live, I can't answer questions. So if you have any burning ones, please pop them there now and tag anyone in the comments below who you think will benefit from this good information too. Okay, so first of all, what is a febrile seizure? So they used to be known as febrile convulsions, fever fits, all the same thing. We're talking about febrile seizures. And what it is it's a fit or a convulsion that happens because of a rapid change. So a sudden and rapid change in your child's temperature, usually associated with a fever. Okay, so this is different to hyperthermia. Hyperthermia is when a child is exposed to external heat, for example, if they've been locked in a car or a hot environment, and that is incredibly concerning and life-threatening. Absolutely is. Febrile seizures are different to that. So febrile seizures are usually caused by a fever, and the good news is that they're usually self-limiting and don't do your child any harm. Good. Phew. So let me explain a bit more about what they are, what they might look like, the age ranges that they affect, and what you need to do if your child has a febrile seizure. So first of all, we've already said that it's usually associated with a rapid or sudden change in your child's body temperature, usually associated with a spike in a fever. Okay, so does that mean that if your child has a fever that they're going to have a febrile seizure? No, it doesn't. Around 1 in 30 children will have a febrile seizure at some stage, and most commonly it's between the ages of 6 months and 6 years. They'll have this. Often children who have repeated febrile seizures can grow out of them, which is a good thing. And even though they scare the pants off you if you see it, if you see your child having a seizure, of course it is going to scare the crap out of you. Of course it is. But the good news is that a simple febrile seizure does your child no harm. Okay, that's important. Now, the other thing that we need to think about is it how high your child's temperature gets, or is it just that sudden spike? Well, at the moment, from the understanding from all the research, is that it's not how high your child's temperature gets or your child's fever gets. It's that sudden spike that actually causes the brain, if you imagine it just has a little, almost like just this kind of, I've lost the word that I'm looking for. I'm after a specific word. It's not coming out. I'll have to leave that. Okay. Short circuit. That's the word I was looking for. Thank goodness we found it. Lockdown brain, maybe, I don't know. So yeah, it's like their brain, this spike of temperature, their brain has this short circuit. They have usually a brief seizure. I'll go into how long in a minute, and then self-resolves. It stops on its own, and it does your child no harm. So your child could perhaps spike a fever from 37 to 38 and have a febrile seizure, or they could just climb slowly to 40 and not have one. So it's not how high the temperature gets. It's that sudden spike. Okay, so we know what they are. Okay, we've talked about that. So what will they look like? Now, you as a parent don't need to diagnose a febrile seizure in your child. If your child has multiple febrile seizures, then your doctor or pediatrician needs to give you an action plan so that you have this special thing that you will do for your child. It might be that you just let it run its course. They might have medications. They might say you don't need to go to the doctors, every time they have a febrile seizure. It's whatever plan is for your child if they have multiple febrile seizures. So you follow that, okay? What I'm talking about today is if your child has their first febrile seizure, okay? So first of all, it's important to remember you don't need to diagnose a febrile seizure. If your child has a seizure, whether it's with a fever or without, and it's the first one, you are calling an ambulance immediately. 000 here in Australia, whatever country you're living in, you'll know the number to call. So that's really important. So what does a febrile seizure look like? What will often happen is, what will happen during a febrile seizure is they will lose consciousness. So they will not give you any purposeful response or make purposeful movements while the seizure is going. What does it look like? It may be simple where they are stiffened up, so their muscles become quite stiff. They may jerk as well. They may become stiff. Their eyes may roll back in their head. Okay, they may become quite glassy-eyed as well. And they may go red or blue in the face, all right, or a purpley colour. While they are having the seizure, this is okay. You do not need to start CPR. They're still breathing. They are just turning this colour during the seizure. If when the seizure stops and they remain blue, if that happens, then you are commencing doctors A, B, C, D. Okay, so they're the steps to ascertaining whether or not somebody needs CPR and then doing it. And of course, that involves having the ambulance coming as well, if it hasn't already been called, because this is, obviously if it's a child's first seizure. So it's okay to be blue during the seizure. It is not okay to be blue when the seizure stops. All right, really important. So how long will it last for? Usually they're quite brief when it comes to febrile seizures, usually less than 5 minutes, but they can be up to 15 minutes as well, okay? So, and that's all right. That's okay. I know it's terrifying, but it's okay, all right? And so what happens when the seizure stops? Generally, they don't just open their eyes and they're back to normal. They're usually really quite sleepy and drowsy afterwards. We expect that to happen, for the next 15, 30 minutes or so, and then start to get back to their normal selves. They may also be quite cranky when they wake up. They may be miserable, they may be crying, they're probably disoriented, and that's normal for that to happen, okay? Yeah, it is. So even though what I'm talking about here is so scary, the important thing for you, I know this is really hard, is to stay calm. Why? Because you can help them much better, okay, if you remain calm. And how do you do that? By arming yourself with knowledge like you are today by watching this, okay? Go do a first aid course as well, all right? The more knowledge you have, the calmer you will be in an emergency situation. So first of all, stay calm. Don't panic if your child is having a seizure. The next thing you're going to do is ensure they are safe. So what are we going to do? If they're on the edge of a couch, if they are, in a place where they're near the stairs, if they're in a high chair, something like that, we are going to move them to a place of safety, okay? So that might be on the floor, okay, it might be with you on a big bed, but of course we're being very, very careful that they can't actually hurt themselves by falling off anything, like falling off the couch or falling off the bed, anything like that. So we're putting them in a safe space. If the floor is hard, put something soft under their head to protect their head, to make sure it's not something big that they're actually going to pop their face into that's a risk of suffocation as well, okay? So we are going to keep them safe, remove anything around them that can hurt them. Do not put anything in their mouth, okay? Nothing in their mouth, because what can happen is that if you put something in there, it can damage their teeth if they have teeth yet. Or if you go and put your hand in their mouth, if they've got teeth, you're going to end up with some serious lacerations on there. It can do so much damage to them. The reason that people used to say to do that was because they believed that you could swallow your tongue. You can't. Okay, it's a myth. You cannot swallow your tongue. While they are having a seizure, yes, they might bite their tongue a little bit, but believe me, that's okay. All right, what we don't want is you having multiple lacerations over your hand or them breaking teeth from biting down on something. So nothing in the mouth, really important, okay? So your child is in a safe space. Roll them on their side when possible. If they are very stiff and jerking, you might not be able to roll them on their side straight away, okay? Leave them on their back. When you can, roll them onto their side. So do that as soon as you can, okay? So roll them on the side. What would be amazing, if you can, is to film it. I know it's like, oh, how could I do that if my kid's having a seizure? You know, I'm not. If you can, film it, because that will help the doctors at the hospital see exactly what's happening to your child rather than you having to describe it, okay? It'll also time it, how long it goes for. If you don't have a phone with you, if you can time it, that's really helpful too, because 15 seconds will feel like 20 hours when your child is having a seizure. You lose all concept of time. So please make sure that you do time it if you can, all right, if it's practical to do so, but even better would be filming it as well from beginning to end if you can, all right? So a little recap: stay calm, keep them safe, put them on their side as soon as you're able to. It may be when the seizure stops, it may be during the seizure, okay? If you can, record the video or the time. It's really, really helpful. And remember, nothing in their mouth. Don't restrain your child from the jerking as well. That can injure them. You don't want to do that. And most importantly, don't put your child in the bath, okay? If your child has a fever and they have a seizure, a lot of people think that, well, I've got to lower the temperature. If I lower the temperature, the seizure will stop. It won't, okay? Putting in the bath while they're having a seizure is just, or even afterwards when they're drowsy as well, that just what it does, it's a drowning risk. It is a real risk to their safety, so don't do it. So what's important? That you call an ambulance as well, all right? Especially if this is your child's first seizure, you really do need to call an ambulance. If it's not your child's first febrile convulsion, maybe they've had one before, if it lasts for more than 5 minutes, call an ambulance as well. Otherwise, you still want to take them. You might want to, when it stops, if there is another adult with you who can take care of your child in the back of the car while you drive and they seem okay, you know, they're almost back to normal, absolutely you can go and get them checked at the hospital afterwards. And it's important that you do want to seek medical help. Remember the exception to the rule: if your child has multiple febrile convulsions and you have your own action plan, you do whatever that action plan is, okay? If your child's still really, really sleepy after the seizure stops and they're just not waking up properly at all, and so they've got a decreased level of consciousness, I'd be quite worried about that. Call an ambulance as well. Or if they look really unwell. So remember, what they've got a fever, Why do they have the fever? It's obviously some kind of infection. If they're really sick, then they may well be needing to go to hospital anyway, okay? So can you prevent febrile seizures? Nope, can't prevent them. Giving your child paracetamol or ibuprofen to try and prevent a seizure, it doesn't work, okay? All the research shows that it just doesn't work to try and prevent them, okay? Unfortunately, it doesn't. And, I guess the other thing to remember as well is that they don't do your child any harm, simple febrile convulsions. Um, I think that's just a reassuring thing. What's very interesting is there is some evidence to say that if you have a family history of febrile convulsions, then your child may be more likely to have them. And as an emergency nurse, the number of times I've been in the hospital and a child's come in with a febrile convulsion and then grandma comes and they go, oh, you used to do this all the time when you were a kid. You had 4 of these. And the mum or the dad's just going, what? You never told me this. And so, yeah, we see it all the time. And so, I'd love to be able to answer any questions that you have now. Now is the time to type them in if you are choosing to watch live. But while you pop your questions in, I just want to summarize it for you, okay? So remember, 1 in 30 kids, but aged between 6 months to 6 years, at some stage will have a febrile convulsion, okay? There is nothing you can do to prevent them, okay? And it's caused by that rapid spike or rapid rise or sudden rise of temperature, okay? It's not how high the temperature gets. During a seizure, remain calm, don't panic. Roll them on their side when you can. Video or time it if you can. And of course, if this is your child's first seizure or any of those other things that I listed before, please call an ambulance, okay? Nothing in the mouth, don't put them in the bath, keep them safe where they are. And of course, remember, what I would love you to do is do a first aid course, because the more knowledge you have, the better it is and the calmer you will be. So let's have a look. Okay, first of all, Sophie has said, son had a febrile seizure that lasted for 7 minutes the first time. So scary. Absolutely. That would have been absolutely terrifying, Sophie. So, obviously being able to share your experience here just to help others would be amazing if you're in a space that you can do that. Please don't worry. Otherwise, please don't if it's, you don't want to talk about it. But I find it really helpful sometimes if people can ask questions and learn from other parents as a resource. But please don't worry if you don't want to share, okay? Please don't worry about that. Now, next, Natalie. Natalie has said her 4-year-old is currently 2 years seizure-free. Great. So first one was 18 months and then a total of 6. Oh, gosh. Very scary to watch, but thankfully all were brief. Interesting, Natalie. You also had them as a child. So there you go. Okay, yep. So often we hear this so much. So thank you, Natalie, for sharing your story too. It shows how common febrile seizures are. Remember, 1 in 30 kids aged between 6 months and 6 years will end up having one. Thank you for sharing your stories. It can be really, really helpful for other parents hearing what happens as well and knowing that there are a lot of you in the same boat, I think, as well. Okay, so that's it for today. I'm looking forward to seeing you again next week. Okay. We'll see you soon. And I hope you have a very, very good rest of the week, everyone. Okay, bye.